Alterations of the integument in children. Acne vulgaris is the most common skin condition in adolescents and young adults, usually appearing between ages 12 and 25. It develops in sebaceous follicles found on the face, chest, and back. These areas have the highest concentration of oil glands. Early intervention helps prevent scarring and complications. Acne can be non-inflammatory or inflammatory. Non-inflammatory acne includes blackheads and whiteheads, also called open and closed comedones. Inflammatory or cystic acne results when these comedones rupture, triggering deep inflammation. This often leads to painful nodules and potential scarring. Several physiologic factors contribute to acne, including excessive keratin buildup, overproduction of sebum, and colonization by Cutibacterium acnes. The bacteria release inflammatory substances that aggravate the skin. Hormones, especially androgens, increase the size and activity of sebaceous glands. That's why acne often worsens during puberty. Acne is managed with topical treatments like retinoids, benzoyl peroxide, and antibiotics. Severe cases may require systemic medications, such as oral antibiotics or isotretinoin. Surgical options include drainage of cysts, and cosmetic procedures like dermabrasion or laser therapy can help reduce scoring. Treatment is individualized based on severity. This slide shows clinical examples of acne at different stages. Visualizing the types of lesions helps clinicians decide on the most appropriate treatment. Patients may have a mix of blackheads, cysts, and inflamed nodules. Acne conglobata is a severe, chronic form of acne that causes interconnected abscesses and deep cysts beneath the skin. It often results in significant scarring and psychological distress. Early aggressive treatment is needed to prevent permanent damage. This form is more common in males and may persist into adulthood. Atopic dermatitis is the most common form of eczema in children and has a strong genetic and immune system link. Symptoms include severe itching and dry, eczematous skin lesions. In infants, the rash often appears on the face, scalp, and trunk, while older children commonly show involvement of the neck, elbows, knees, hands, and feet. Management focuses on hydration, avoiding triggers, and anti-inflammatory treatments. This image shows the classic appearance of atopic dermatitis in children. The skin looks dry, red, and irritated, and scratching can lead to secondary infection or thickening. Caregivers are encouraged to use gentle skin products and apply moisturizers consistently. Diaper dermatitis is a common form of irritant contact dermatitis seen in infants. It's caused by prolonged exposure to urine, feces, and moisture, especially under tight plastic diaper covers. The condition may become secondarily infected with Candida albicans. It typically affects the lower abdomen, genital area, buttocks, and upper thighs. Clinical signs range from mild redness to papular rashes and sometimes open lesions. Treatment includes keeping the area clean and dry, using barrier creams, and applying antifungal medications when Candida is involved. Preventative care is key, including frequent diaper changes and breathable materials. Impetigo contagiosum is a highly contagious skin infection, most commonly caused by Staphylococcus aureus. It is more frequent in hot, humid environments and presents in two forms, non-bullous and bullous. Bullous impetigo involves blister formation, while the more common non-bullous type shows honey-colored crusts, especially around the mouth and nose. Treatment includes topical antibiotics and systemic antibiotics in more severe or widespread cases. This slide provides a visual example of impetigo. The hallmark honey-colored crust is clearly visible, typically forming after the blister's rupture. Prompt treatment helps reduce transmission and prevent complications. Staphylococcal scalded-skin syndrome is a serious condition caused by toxin-producing strains of group 2 Staphylococcus aureus. It results in the separation of skin layers just below the granular layer of the epidermis. Children may experience fever, malaise, nasal discharge, skin tenderness, and widespread erythema. Treatment involves antibiotics and strict hygiene to prevent secondary infections. Tinea capitis, or scalp ringworm, is the most common fungal infection in children. It spreads through direct contact with infected individuals, pets, especially cats and dogs, or contaminated objects. Lesions appear as circular patches with broken hairs, scaling, and raised edges. Tinea corporis, or body ringworm, causes red, scaly, ring-shaped patches, often spread by contact with kittens or puppies. This image shows typical presentations of tinea infections, highlighting the circular shape and scaling edges. The center often clears as the infection spreads outward. Early diagnosis helps reduce transmission and speeds up recovery. Thrush is a fungal infection caused by Candida albicans, often found in the mouths of infants. It presents as white plaques on the tongue and inner cheeks, which may lead to shallow ulcers. In some cases, thrush can spread to the diaper area or other parts of the body. Treatment involves oral antifungal suspensions, and maintaining good hygiene helps prevent recurrence. Molluscum contagiosum is a highly contagious viral infection spread through direct skin contact or self-inoculation. It causes small, dome-shaped papules with a central indentation, most often seen on the face, trunk, and limbs. The virus promotes abnormal skin cell growth, but is usually self-limiting. Treatment may involve topical therapies or physical removal. This slide shows classic molluscum lesions, smooth, skin-colored, and centrally umbilicated. They may appear in clusters and can persist for months. Treatment is optional in mild cases, especially in children. Rubella is a mild viral illness transmitted through respiratory droplets. Children may have enlarged lymph nodes, a low-grade fever, sore throat, and a faint pink rash that starts on the face and spreads. The rash is maculopapular and resolves within a few days. Vaccination with the MMR shot offers lifelong protection. This image shows the typical rubella rash spreading from the face to the trunk. While mild in children, rubella poses serious risks to unborn babies, making vaccination especially important for pregnant women. Rubeola, or red measles, causes high fever, runny nose, conjunctivitis, and the classic Koplik spots inside the mouth. A widespread rash follows these symptoms. Roseola presents with a sudden high fever that resolves before a pink rash appears, usually lasting about 24 hours. Both illnesses are viral and self-limiting in most cases. Smallpox was a highly contagious and deadly disease, but was declared eradicated in 1977. Routine vaccination ended in 1972, but a new vaccine now exists as part of the U.S. Strategic National Stockpile. Though no longer a natural threat, smallpox remains a concern for bioterrorism preparedness. Chickenpox is a highly contagious illness caused by the varicella zoster virus. It presents with itchy vesicular lesions that rupture and crust over. Complications are rare in children, but more common in adults. Herpes zoster, or shingles, occurs when the dormant virus reactivates later in life, often causing a painful rash. This image shows the classic vesicles of chickenpox at different stages: blisters, ruptures, and crusts. Children typically recover well, but vaccination helps prevent both varicella and future shingles outbreaks. Hand, foot, and mouth disease is a viral illness that causes fever, mouth ulcers, and rashes on the hands, feet, and buttocks. It's common in young children and usually resolves with supportive care. Erythema infectiosum, or fifth disease, starts with mild flu-like symptoms and a slapped cheek rash that spreads to the trunk and limbs. The rash can last several weeks, but is typically harmless. Scabies is a contagious skin condition caused by the itch mite Sarcoptes scabii. It spreads through close personal contact or by sharing infested clothing or bedding. The female mite burrows into the skin, lays eggs, and causes intense itching. Lesions often appear as burrows, small bumps, or vesicles, and are prone to secondary infection from scratching. This image shows classic scabies lesions, small, inflamed burrows often found between fingers or on wrists. Treatment includes topical scabicides and washing all linens and clothing in hot water. Treating close contacts is also essential to prevent reinfestation. Pediculosis is a lice infestation that can affect the head, body, or pubic area. Lice feed on human blood and cause intense itching. Transmission occurs through direct contact or by sharing items like hats or combs. Treatment includes pediculicide shampoos and washing all clothing, bedding, and hair tools in hot water. Flea bites often appear in clusters, especially on the legs or where clothing fits tightly. The bites are itchy and form red, swollen wheals with a central puncture point. Treatment includes treating pets and home environments to eliminate fleas, along with managing itching and inflammation. This slide offers visual references for common insect bites. Recognizing bite patterns helps distinguish between fleas, bedbugs, and other parasites. Accurate identification ensures proper treatment and prevention. Bedbugs are small, reddish-brown insects that hide in mattresses, furniture, and wall cracks. They feed at night and leave behind red, itchy macules or nodules. Infestations can be difficult to eliminate and require deep cleaning or professional pest control. Discarding infested items and using insecticides may be necessary. Cutaneous hemangiomas are common benign vascular tumors of infancy. Superficial hemangiomas usually appear between 3 to 5 weeks after birth and grow rapidly, forming bright red, raised lesions. Deep hemangiomas are present at birth and appear as soft, purplish masses. While most resolve over time, some may require treatment based on size or location. This image shows both superficial and deep types of hemangiomas. Superficial lesions are capillary-rich and elevated, while deeper ones have a sponge-like texture. Monitoring is often enough, but problematic cases may be treated with beta blockers or laser therapy. Vascular malformations are rare congenital anomalies of blood vessels present at birth. They are classified by flow type: low flow involving capillaries, veins, or lymphatics, and high flow involving arteries. Unlike hemangiomas, they do not proliferate or regress over time. Treatment depends on type, symptoms, and cosmetic concerns. Port wine stains are flat, reddish-purple birthmarks caused by malformed dermal capillaries. These lesions typically darken with age and can thicken if untreated. Salmon patches, also known as stork bites or angel kisses, are pink macular lesions that usually fade by 1 year. Port wine stains may respond to pulse dye laser therapy. This slide shows examples of port wine stains and salmon patches. Proper diagnosis helps determine whether treatment is needed. While salmon patches are harmless, port wine stains may sometimes be linked to underlying syndromes. Miliaria is a sweat gland disorder caused by blocked eccrine ducts due to excessive heat or sweating. Miliaria crystallina presents as tiny, clear vesicles without redness, while Miliaria rubra, also called prickly heat, features red papules or papullovesicles. It is common in hot, humid environments. Treatment includes cooling the skin and reducing sweating. This image displays Miliaria rubra, a common sweat-related rash in infants and children. It appears as red papules or tiny blisters on areas of the body exposed to heat or friction. The condition is caused by blockage of sweat ducts, leading to inflammation and irritation. Treatment involves keeping the skin cool and dry, and avoiding overheating. Erythema toxicum neonatorum is a common and harmless skin condition seen in newborns. It presents as red macules, papules, or pustules, usually within the first few days of life. The exact cause is unknown, but it is not infectious or dangerous. It resolves on its own without any treatment and requires only reassurance to parents.